This video will cover chronic eosinophilic leukemia, a myeloproliferative neoplasm. To anchor ourselves, take a look at the character here. It's Luke Skywalker from the Star Wars movies, and he's wearing an orange outfit. Luke is going to remind us of leukemia, and Luke is holding a nice warm bowl of oatmeal with raspberries. The bowl of oatmeal represents eosinophils, since oatmeal sounds similar to eosinophil. The raspberries are just an extra way to remember the eosinophilic granules. I also gave Luke an orange outfit to really hammer that this video is about eosinophilic leukemia. It looks like Luke works for that Metropolitan company, which we've covered extensively in other videos. If you shorten the word Metropolitan, you can get to MPN, which is what we're going to use to remember that this is a myeloproliferative neoplasm. Now that we're anchored, let's move on. This is a disease predominantly of men, with a 9-to-1 male to female ratio. And well, since we only have a male character in this image, that's how we're going to remember that. Besides the obvious peripheral blood eosinophilia, there is often tissue infiltration and damage with eosinophils. Common sites of infiltration are the heart, GI tract, lungs, and CNS. The heart is easily represented by this sign here. The GI tract and lungs, well, are what Luke is about to eat, unfortunately for him. We're going to remember the CNS by his abnormally large head and how he's pointing at it. My man's got big brains. Lastly, to diagnose this, there must be no evidence of one of the defined syndromes with eosinophilia, such as PDGFR alpha and PDGFR beta rearrangements or FGFR1 rearrangement. To remember that there must not be an FGFR1 rearrangement, look at this fruit here. It's a fig, and since there's a big red X on it, we're going to remember that the rearrangement must not be present. I have nothing against figs, okay? I'm honestly not sure if I've ever had a fig. Do Newton figs count? But anyways, the fig fruit is going to help us remember FGFR. Not much explanation needed. To help us remember that there must be no PDGFR rearrangements, notice what our character is daydreaming about. A pagoda tower. Pagoda has the letters P, D, and G, just like PDGFR. And the fact that he's only daydreaming about the tower and that the tower doesn't actually exist will remind us that there must not be PDGFR rearrangements.